So talking to your child about their colorectal malformation is not something that should occur just one time. It's something that it should occur over their lifetime and change based on their development and the kind of questions they might have. And ideally, it starts as a very young child, so it's part of their story. So maybe when they're young, when you were born, the hole that you have to poop through wasn't totally open or wasn't there, and so the doctors fixed it. And as they get older, they'll have more questions about what does that mean and how does it impact them that day. And the important thing that I tell parents is to follow the child's lead. So ask the kid what they want to know and follow their lead rather than giving them all the information at once. Because at first, the explanation of when you were born, the hole wasn't there is all they really want to know. And as they get older, they'll ask more questions. I think one of the most important things is to create an environment in your family where the child is comfortable talking about their medical condition and asking questions when they do come up. Talking to other kids about their medical condition is a complicated question because it includes divulging some private information. So the question is how much does the kid want to give to other kids? How much do you want the child to give to other kids? And it's finding a balance between this isn't something you need to be ashamed of, but also talking about how we pee and poop is not something in our culture that we talk about with anybody. It's important to help kids come up with an explanation that they're comfortable with, but also that is going to suffice for other children so that they won't continue asking questions. So an answer like, I don't feel like talking about it, might encourage more curiosity rather than less. I often help kids come up with an explanation that makes sense but doesn't give too much information. Oh, I have to take a special medicine in the nurse's office. I just like to use the nurse's office because I feel more private there. Why were you out so many days? I had a doctor's appointment. They don't necessarily need to talk about what the doctor's appointment is for. Sometimes kids talk about they have stomach problems or they need help with their stomach rather than they have trouble pooping or they need to go poop a lot. Because again, I try to talk to kids about that's not something we talk about with anybody outside of our family, whether you have a colorectal malformation or not. But you also want to set up an environment where the child is not ashamed of who they are and how their body might be different. So it is really challenging finding that balance. And as kids get older is a time where I've worked with some teenagers to maybe share with their best friend, their special friend, somebody they can really trust, what's different about their body so that they can feel like they're not alone with that information.